Hey everyone, Rebecca Ward here, therapist, healer, author, and coach. Today, I'm going to introduce you to one of the most essential practices you can do to optimize your health, to reduce inflammation, lower stress, regulate heart rate, lower blood pressure, support digestion, and allow more room for you to live your life feeling safe, content, calm, spacious, creative, and innovative. And there's only one simple practice you need to learn to do that today. Inside the body, our nervous systems are guiding us every moment to stay safe. Just as it did millions of years ago, it continues to first notice the potential for threat. Its job is to keep us safe. But often it has difficulty distinguishing between a saber-toothed tiger lurking in the grass, as it recalls from our primitive ancestors, and a stressful situation at work, with our boss, with our partner, our friends, a child. In the modern world, it makes no distinction between those stressors and a saber-toothed tiger from primitive times. We need to teach it how to do that so that the body and mind can feel spacious, open, creative, and connected, so that the immune system isn't channeling attention away from its essential role to fight off disease. And it's keeping us from warding off a false threat when it's activated, when a nervous system is activated like that. And that's what we call a paper tiger. It's a false threat. There's no saber-toothed tiger lurking in the grass, right? So what is the most essential part of the nervous system to do that? Well, it's the vagus nerve. And the vagus nerve is the 10th cranial nerve. It is the largest bundle of nerves in your body. And it's called vagus, V-A-G-U-S, is Latin for wandering. You'll understand as you begin to visualize this and see this chart and how many organs are connected to the vagus nerve. It begins its journey, as you'll see here on the chart, at the brainstem and wanders its way to your eyes, your ears, your nose and face and neck muscles, sinuses, the tongue, throat, vocal cords. It assists in vocalization, the windpipe, lungs, where it helps regulate your breathing, and your heart to regulate your heart rate. It connects to the stomach, the pancreas, the kidneys, and the gut, the large and small intestine, to support digestion. And when we're relaxed, this bundle of nerves supports our health by regulating these critical organs. What it's not connected to is your higher order thinking brain, the prefrontal cortex. It is only connected to the brainstem and then onto your fear brain, the amygdala. So when we're under stress, this nerve will constrict not only these organs in an effort to conserve our energy for a survival response, fight, flight, or freeze. It will also compromise our immune system's ability to fight off disease. And it sends a message to your brain, to that fear brain, that you're under threat. And that's what causes all of the stress and the anxiety we experience on a daily basis. So to regulate this nerve, this is the one simple practice you can learn to do. It was developed by Dr. Peter Levine, the founder of Somatic Experiencing, which is a trauma-informed modality that trauma therapists like myself have learned. I'm going to teach you how to do what he calls the VOO breathing method, V-O-O. It's similar to Om, but that's that movement of the mouth here, VOO, engages more of this part of the vagus nerve than Om does. So it vibrates the vagus nerve when you make that sound and your out breath. And over time, it's going to help you learn, your system will begin to learn to regulate itself, the nervous system. So first, this is how you do it. You want to stretch your jaw. A lot of people hold stress in their jaw here. So stretch it out like that. That feels so good. Feels great. All right, so that's step one. Relax your tongue on the lower palate of your mouth. Why? Because that helps support the parasympathetic, the rest and digest part of your nervous system. And you want to put a little bit of space between the top and bottom teeth. That also helps relax the jaw. Now, you want to place a hand here on your heart space, the other hand on your belly. Tip your chin down just a little bit. Why do we do this? The hands, the chin being tipped down a little bit helps support what we call the medial prefrontal cortex, which is the observing part of your brain. Connect it to your body. You're wanting to notice the sensation of this vibration that's going to happen. That's what helps regulate the brain and the body. We're doing a bottoms up intervention with this VU breathing method. And then I will teach you the other part, which is a top down intervention. And the two together will help regulate your nervous system. So I'm going to demonstrate this for you. Hands on your heart space here in the center of your chest, the other hand on your belly. You're going to want to feel the support behind you and beneath you. And you're going to breathe in through your nose, out through your mouth. Nice long in breath through your nose. If you can modify this if it doesn't work for you. Breathing in through your nose, nice long in breath, and an out breath through the mouth. Remember to use the lower register of your voice as you make the sound so that the vibration can go as far down as you can get it. And then if you have some difficulty with deep breathing, take a rest in between the VU breathing. So just a regular, nice, calm breath in between the VU breaths. And you want to do the VU breathing roughly no more than 5 times, but I would say maybe 3 or 4 times. And then I'm going to show you on the last out breath what to do to communicate from the mind to the body. So we're doing a body to mind right now with the VU breathing. And then on the last out breath, we're going to access your language center to help the mind seal the connection with your nervous system so that it's a full body experience. Okay, so here's how it goes. I'm going to do 3 VU breaths, and then I'll show you the mind to body intervention on the last. Okay, all right. Breathing in through the nose. Gentle breath in between if you need it. And again. Gentle breath. And again. All right, now I'm going to show you what you do to help seal the mind connecting with the body, accessing the language center. We're going to say these simple words back to the body. I am safe. And what we're going to do is do that at a whisper level volume and repeat those words. So just pay attention to how I'm doing this. Breathing in. I am safe. 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 And you might notice more connection to gravity, more settling in the body. What you want to pay attention to is what's different. Do I find myself more spacious here? Something feeling lighter or heavier, more dense? A change in temperature, maybe it's cooler. Something feels more open here, more connection to your sit bones and the chair that you're seating in. All kinds of things can come up in this experience, including nothing, which is also information. That just simply means that we need to stay with the practice longer to be able to connect to our sensations again. And if you take up this practice over time, you will begin to see a difference. You'll have more access to your emotions, more access to better decision making. Your instincts are in your gut. So if we have a regulated digestive system, when people say trust your gut, they literally mean that. Trusting your instincts. And the vagus nerve, when it's settled, gives you more access to sharper decision making. That's a better, actually, your gut is a better decision maker often than your brain, because the brain can be in a fear response. So take up this practice. And if you notice over time, just pay attention. What's different? What's different in your mood, your sleep, how you respond to stressful situations, in stressful people? Are you less reactive? What do you notice? What do you notice in the practice of this? And what we say about the repetition of practice is that if you repeat a practice 300 times, it's in your muscle memory. So if you imagine doing the VU breathing 5 times a day, or 5 times in the morning, 5 times at night, that's 30 days. It's in your muscle memory. And if you keep up that practice 5 times in the morning, 5 times at night for 10 months, roughly, that's 3,000 times. It's your new normal now. This is embodied in your nervous system and every cellular structure in your body. So give it a try. See what you notice. Give it some time, okay? Don't assume that it's going to just fix things right away. But you will see over time that vagus nerve is going to settle your critical organs and channel that energy back to having them do their job again. Okay? All right. Pick up my book, The Paper Tiger Syndrome, How to Liberate Yourself from the Illusion of Fear. It has this practice and many other practices that will help you liberate yourself from paper tigers, the illusion of fear. Take care.